7 common causes of low blood pressure you need to know. Did you know that while everyone talks about the dangers of high blood pressure, low blood pressure can be just as serious? Imagine feeling lightheaded, tired, or even fainting without knowing why. These could be signs of low blood pressure, something that affects more people than you might realize, but is often misunderstood or overlooked. Today, we're diving deep into the 7 most common causes of low blood pressure that everyone should know about. In this video, we're going to cover what makes your blood pressure dip and why it matters for your overall health. Many think low blood pressure is always a good thing, but that's a misconception. It can lead to a range of symptoms, from fatigue and weakness to even life-threatening situations in extreme cases. Knowing what causes these drops can make all the difference in managing your health and avoiding unnecessary discomfort. So whether you're dealing with symptoms of low blood pressure or just curious about what could be causing those dizzy spells, stay tuned. We're going to break down each cause in a clear, straightforward way. And by the end of this video, you'll be equipped with the knowledge you need to understand and manage low blood pressure effectively. Cause 1. Dehydration. Let's start with one of the most common and often overlooked causes of low blood pressure: dehydration. Did you know that up to 75% of Americans may suffer from chronic dehydration without realizing it? When your body lacks adequate fluids, blood volume decreases, which means there's less blood flowing through your arteries and veins. This drop in blood volume is a key reason why your blood pressure falls, sometimes leading to symptoms like dizziness, fainting, and severe fatigue. Think about it this way: your blood is made up of nearly 90% water. When you're not drinking enough fluids, your blood thickens and moves slower, making it harder for your heart to pump it efficiently. Whether it's because you've been sweating during exercise, spending time in the sun, or even due to simple things like forgetting to drink enough water throughout the day, dehydration can sneak up on you and impact your blood pressure significantly. For example, studies show that even mild dehydration can lower blood pressure and reduce concentration levels. A good rule of thumb is to drink at least 8 8-ounce glasses of water daily, or more if you're active or live in a warm climate. Remember, hydration isn't just about avoiding thirst, it's about keeping your blood pressure steady and your body functioning smoothly. So, grab that water bottle and take a sip now. Cause 2. Nutritional deficiencies. Nutritional deficiencies might seem minor, but they can have a huge impact on your blood pressure, particularly causing it to drop unexpectedly. A lack of essential nutrients like vitamin B12, folate, and iron directly affects the number and quality of red blood cells in your body. Without adequate red blood cells, your body can't carry enough oxygen to your organs and tissues, leading to a decrease in blood pressure. Let's break it down. Iron deficiency, one of the most common deficiencies worldwide, can lead to anemia, a condition where your blood doesn't have enough red blood cells to transport oxygen efficiently. Low iron levels affect nearly 30% of the world's population, especially women, causing symptoms like fatigue, shortness of breath, and yes, low blood pressure. Similarly, vitamin B12 and folate are crucial for red blood cell production, and without them, blood pressure can dip as a result. If you often feel lightheaded or exhausted, a nutrient deficiency might be the hidden culprit. Incorporating foods rich in these nutrients, like leafy greens, lean meats, eggs, and fortified cereals, can make a big difference. Sometimes, even with a balanced diet, supplements might be necessary, so consulting a healthcare provider is key. Addressing these deficiencies can help stabilize blood pressure and boost energy, giving your body the support it needs to function optimally. Cause 3. Heart conditions. Heart conditions are one of the less obvious but very serious causes of low blood pressure that can impact people of all ages. When your heart isn't pumping blood effectively, your blood pressure can drop, leading to symptoms that might catch you off guard. Conditions like bradycardia, which is an unusually slow heart rate, can mean your heart isn't circulating blood fast enough to meet your body's needs. Similarly, issues with heart valves or heart failure can also disrupt blood flow, causing your blood pressure to drop dramatically. Recent studies show that over 10 million adults in the US alone experience low blood pressure due to heart-related issues, with many cases going undiagnosed until symptoms become severe. Low blood pressure from heart conditions can lead to dizziness, shortness of breath, and even fainting, symptoms that are easy to dismiss as tiredness or stress. But ignoring these signs could mean missing an early warning of a serious heart issue. If you've ever felt unusually weak, fatigued, or found yourself struggling to catch your breath, especially after mild activity, it may be more than just low energy. Monitoring these symptoms and speaking with a healthcare provider could uncover a hidden heart condition that's affecting your blood pressure and overall health. Cause 4. Endocrine issues. Endocrine issues are a surprising yet significant cause of low blood pressure, often flying under the radar because their symptoms can seem vague or unrelated. The endocrine system produces hormones that regulate everything from metabolism to stress responses. When this delicate system is off balance, it can impact blood pressure in unexpected ways. For example, adrenal insufficiency, a condition where the adrenal glands don't produce enough cortisol, can cause chronic low blood pressure and make it difficult for your body to respond to physical stress. Similarly, an underactive thyroid, hypothyroidism, slows down your metabolism, leading to fatigue, weight gain, and a drop in blood pressure. Hypothyroidism affects roughly 5 in 100 people in the United States, with many cases going undiagnosed due to mild or non-specific symptoms. Another endocrine-related cause is diabetes, particularly when blood sugar levels aren't managed well. Blood sugar highs and lows can impact blood vessel tone and hydration, both of which influence blood pressure. If you experience symptoms like fatigue, muscle weakness, or even dizziness without explanation, it could be due to an endocrine imbalance. Recognizing these signs and consulting with a doctor for hormone testing can make a world of difference. Proper diagnosis and treatment can not only address these symptoms, but also significantly improve your overall quality of life. Cause 5. Severe infection or allergic reaction. Severe infections and allergic reactions aren't just frightening, they can also lead to dangerously low blood pressure, a condition that requires immediate attention. Let's break it down. When your body experiences a severe infection, such as sepsis, your immune system goes into overdrive, releasing chemicals to fight off the infection. However, these chemicals can widen your blood vessels and cause your blood pressure to plummet rapidly. This condition, often called septic shock, has a staggering mortality rate of nearly 40% if left untreated. It's a serious, life-threatening condition, with symptoms like fever, rapid heartbeat, confusion, and intense weakness. Similarly, anaphylaxis, a severe allergic reaction to substances like certain foods, insect stings, or medications, can send the body into shock. In an anaphylactic reaction, the immune system releases an overwhelming amount of chemicals that can cause the blood vessels to widen and blood pressure to drop suddenly. Common symptoms include swelling, difficulty breathing, rash, and fainting, all of which require immediate intervention. Both of these conditions show just how vital blood pressure is to your health. If you ever notice these signs in yourself or someone else, seek emergency medical help immediately. Cause 6. Blood loss. One of the more alarming causes of low blood pressure is blood loss, which can have serious, immediate effects on your body. Think about it. When you lose a significant amount of blood, whether from an injury, surgery, or even internal bleeding, your body suddenly has less blood volume to circulate. This reduction in volume leads to a sharp drop in blood pressure, which means less oxygen and nutrients are delivered to your organs, making you feel dizzy, weak, and even disoriented. Blood loss doesn't have to be dramatic to cause problems. Even a moderate internal bleed, like from a stomach ulcer, can lower blood pressure over time and cause persistent fatigue, lightheadedness, and pale skin. Statistics show that trauma-related blood loss is responsible for 40% of deaths in trauma patients, making it the leading cause of preventable death in these cases. This is a reminder of just how critical it is to recognize the symptoms early and seek medical attention. If you notice signs like rapid pulse, cold skin, confusion, or even fainting, it could indicate severe blood loss, and you need immediate help. Awareness is key here. Knowing these symptoms and responding quickly could save a life. Cause 7. Pregnancy. Pregnancy is a time of major changes in a woman's body, and one of those changes can be a noticeable drop in blood pressure, especially during the first and second trimesters. In fact, it's completely normal for blood pressure to fall as much as 10 to 15 points in early pregnancy due to the expansion of blood vessels and increased blood flow needed to support the growing baby. But what does this mean for you, and when does it become a concern? Low blood pressure in pregnancy can lead to symptoms like dizziness, lightheadedness, nausea, and even fainting, symptoms that might seem mild but can actually pose risks. Imagine standing up too quickly, feeling faint, or losing balance. This can result in falls or other accidents, which is particularly dangerous during pregnancy. Experts advise monitoring these symptoms closely, as consistently low blood pressure could sometimes be linked to dehydration, nutritional deficiencies, or even underlying heart issues that may require a healthcare provider's attention. The good news? Most of the time, blood pressure naturally rises again in the later stages of pregnancy as the body adjusts. However, staying informed and keeping a close eye on these symptoms can make a huge difference in ensuring a healthy pregnancy for both you and your baby. Stick around to learn more about how pregnancy impacts blood pressure and what steps you can take to manage it safely. As we've explored today, low blood pressure is more than just a number. It's a signal from your body that something may need attention. From dehydration and nutritional deficiencies to heart conditions and endocrine issues, understanding these common causes of low blood pressure empowers you to take control of your health and recognize symptoms before they impact your daily life. So what should you do next? Start by keeping an eye on how you feel, especially if you experience dizziness, fatigue, or other symptoms we've discussed. If anything seems off, don't hesitate to talk to a healthcare professional. Sometimes, making small changes like drinking more water, adjusting your diet, or checking your medications can make a big difference. If this video helped you understand low blood pressure and its causes a little better, please give it a thumbs up. Don't forget to share it with friends or family who may find it useful too. And for more health tips and insights into managing everyday wellness challenges, hit the subscribe button and turn on notifications so you never miss a video. Thanks for watching, and here's to a healthier, more informed you.